So orthotics are here to change a situation. That means, and Zac, you might have something to add, but that means we have a situation that causes some issues. You have some foot pain, and there's a reason for it. And we do not treat any symptoms just by making large cushions or so. What we do is treat the cause of the issue with the orthotic. That means we check what's wrong and we want to go right to the root of it and change it. So our orthotics, or orthotics in general, should be a training device. The more you use them, the more your body changes and adapts to the orthotic and changes over time.
Great. Yeah. Anything to add, Zac?
No, I think Dominik kind of summed it up. I think for most intents and purposes, they can be used interchangeably. The important part is what is the actual device, whether you call it an insole, an insert, an orthotic. What is it doing? How is it designed? And what is it made out of?
Right. Okay. And when you think about custom orthotics, where does somebody get a custom orthotic versus where does somebody get a insole? Well, like, tell us a little bit more about kind of the market itself.
Sure. So when I'm gonna refer to custom orthotics, I really mean a device that a trained clinician is considering both your foot and your activity goals, and then building something to correct and adapt for those things that are personal to you. So in the United States, at least, there's several avenues. There's, of course, podiatrists or foot doctors. They're kind of the bread and butter salespeople of custom orthotics. They typically do a good job. The problem is they're incredibly expensive, and a lot of them are using outdated technology. They're using plaster casts to get a foot impression. They're using a limited range of materials and design technologies, a lot of milling, a lot of shaping hard plastics and gluing things together. And the reason is that when these doctors trained 10, 20, 30, 40 years ago, they learn a way of building and designing, and there's no reason for them to improve. The other common avenues that people get custom orthotics are from physical therapists. A lot of physical therapy clinics either partner with manufacturing centers or they have their own internal manufacturing center for custom orthotics. Some chiropractors have their own shop for custom orthotics. And then there's places where you can go a little bit less clinical, more retail. So in the United States, there's something called the Good Feet store where people go. They work with a sales representative at the store who then gives them just a piece of plastic that's 3/4 length of the foot. They cost something like $1,200. So very expensive, but some people do have good outcomes with them. And then on the kind of more convenient and accessible side of the spectrum, you have online custom orthotics makers. Of course, Stride Soles. We are the ones who are the most clinically adept. We have a whole team of podiatrists and podorthists making the orthotics, but there's other companies as well. Upstep is a really famous one. They send out foam impression kits. People step in, you send them back, and they made custom orthotics from them.
Awesome. Yeah. Great response. And what would you say are like the big differences between going to an online place like Stride Soles versus going into a podiatry clinic?
So I'll talk a little bit about what happens online in Stride Soles, and then maybe Dominik, you can share a little bit about the podiatry clinic. So for Stride Soles, we try to hit all the major things that are necessary for corrective custom orthotics. That is, we ask you or the patient the same questions they'd be asked if they came into clinic. Where is their pain? What are their activity levels? What are they trying to accomplish? Have they ever been diagnosed with any previous foot conditions before? Of course, we get an image of the foot through the 3D scanning process, and we also get a gait analysis. We actually observe the patient walking toward and away their smartphone camera, which we then analyze and can understand things like knee position, varus valgus, or are they bone kneed or knock kneed, ankle position, ankle supination, pronation, and kind of the essential tools in order to then build your custom orthotics. I think the big difference is that we're a lot more accessible. You don't need to make an appointment. You don't need to get a referral from your general practitioner, which is something that you definitely would need in the United States. And because custom orthotics are typically not covered by insurance, it's just a lot more cost effective. I'll let Dominic add maybe a couple more features that happen in the actual podiatry office and kind of where those features are really critical and where they're not.